y'all, it's Dr. Harper. You may not know this, but there are many medications that can have an effect on sexual desire. In fact, when a new patient comes to see me, taking a look at her current list of medications is an extremely important part of the evaluation. Many of us are on medications or supplements every day for one reason that may have other unintended effects. In the next few minutes, we'll go over the most common medications that can affect sexual function. By far and away, the most common medication that people take that has a negative effect on sexual function are medications for depression. These medications are extremely common and for many people, extremely necessary. I do not want anyone watching this video to discontinue the medication they're taking for depression or anxiety without first talking to their prescribing doctor. This too can have many unwanted effects, such as relapse of depression and the myriad of issues that come along with that. In fact, women who are depressed and untreated have worse sexual function than those that are depressed and treated. So what do we do? The answer is usually some behavioral change, like reading erotica and adding in exercise, and sometimes changing your medication. Some depression and anxiety medications are better for sexual function than others. This is definitely worth a conversation with your doctor. I've talked to many patients who are nervous to tell their doctor about the side effects they're experiencing, but I promise you it is worth it. Schedule a visit specifically to discuss the issues you're facing, and you can find a new medication together. Your sex life and personal fulfillment are absolutely worth it. Some other common medications that can affect sexual function include beta blockers, antihistamines, and some types of birth control. Let's break down the birth control question for a minute. As I'm sure you know by now, there are many options when it comes to preventing pregnancy. Some may have less of an effect on sexual function than others. For example, a large study found that women taking birth control pills had mixed results in terms of sexual function. 12% had an increase in desire, 84% had no change, and about 4% had a decrease in desire. Your outcome will depend on your body, your natural sex drive, and the type of pill that you choose. Other studies have suggested that IUDs and the implant that goes in your arm likely have less of an effect on sexual function. What I know from practice is that every single woman is different. There is no one right form of birth control for every person. When making this decision, there are many things to consider, including sexual side effects. I hope this information is helpful when you're choosing your next medications or evaluating the ones you're currently on. It's important to always understand how they may be affecting your sexual function and discuss these issues with your prescribing physician.